Madam Speaker, tourism earnings have grown by 13.1% to US dollars 1.52 billion in 12 months to March 2025 from US dollars 1.36 billion during the same period in 2024. This impressive growth is attributed to the sustainable peace, increased competitiveness of Uganda's tourism industry, and government investment in strategic tourism infrastructure, including Uganda Airlines, remittances from Ugandans living and working abroad were US dollars 1.4 billion 12 months to March 2025, compared to US dollars 1.33 billion in the same period in 2024. Madam Speaker, Uganda has maintained its top ranking as one of the best investment destinations in Africa. Let me repeat this. Madam Speaker, Uganda has maintained its top ranking as one of the best investment destinations in Africa. Foreign direct investments were worth US dollar 3.4 billion in 12 months to March 2025, compared to US dollars 2.99 billion during the same period in 2024. This performance was due to improved competitiveness of our economy. Fiscal performance. Madam Speaker, revenue collection is projected at shillings 31.9 trillion this financial year ending June 2025, equivalent to about 14.3% of total domestic economic output, or GDP. Total expenditure outturn is estimated at shillings 51.53 trillion this financial year, excluding Bank of Uganda securities and domestic financing date rollover. The budget deficit is estimated at 7.2% of GDP. Madam Speaker, government plans to collect shillings 37.2 trillion in domestic revenue next financial year 25-26. This will finance about 60% of the national budget. The rest of the budget will be financed through borrowing and grants. Madam Speaker, government has stepped up efforts to mobilize domestic revenue. Going forward, emphasis will be put on the following. 1. Broadening the tax base through strategic investment in the opportunities in agro-industry, tourism, minerals, including oil and gas, science, technology, and innovation, including ICT, as well as interventions that support wealth creation and the growth of small and medium enterprises. Eliminating corruption at URA through punishing corrupt officers and taxpayers who collude with URA staff, as well as leveraging digital platforms to minimize human interaction. 3. Enhancing implementation of electronic fiscal receipting and invoicing solutions, which is abbreviation EFRIS, digital tax stamps, rental tax solution, and regular audits, especially for transfer pricing. Combating smuggling at border points through extended surveillance using advanced technologies like scanners, drones, and tracking systems, with increased patrols in high-risk areas. Rationalizing tax exemptions to focus on only those that support industrial policy and introducing sunset clauses. Amending tax laws to close loopholes that cause revenue leakage and providing clarity to encourage voluntary compliance. Strengthening URA in including recruitment and training of tax officers to effectively administer tax collection, and supporting local governments and revenue-generating public entities to increase revenue collection. Accountability for financial 24-25 and priorities for the financial 2025-26. Madam Speaker, when I delivered the budget speech for financial 24-25, I made several commitments on government expenditure priorities for the financial year. In February 2025, I presented a detailed semi-annual budget performance report of this financial year to Parliament in line with the law. In this section, I provide the highlights of what government has achieved this financial year to date. Madam Speaker, with respect to investing in people of Uganda, the following has been achieved. Let me repeat. Madam Speaker, with respect to investing in the people of Uganda, the following has been achieved. Health. Madam Speaker, during this financial year 24-25, the following milestones have been achieved in the health sector. 1. Government continued to invest in saving the lives of Ugandans by providing shillings 721 billion for healthcare supplies, general and essential medicines under the national medical stores. This included additional financing of shillings 100 billion for essential medicines, shillings 116.8 billion for RRVs, shillings 2.9 billion for anti-malaria medicines, shillings 17.8 billion for immunization supplies, and shillings 52.3 billion for laboratory supplies, and shillings 2.1 billion for anti-TB drugs. Government continued to improve healthcare infrastructure and equipment. For example, we completed, equipped, and commissioned 3 regional blood banks in Hoima, Arua, and Soroti, operationalized 16 high-capacity oxygen plants across key regional referral hospitals, continued infrastructure development and equipping of the 2 specialized centers for cancer and cardiovascular care. Infrastructure development of Ruvoa Specialized Hospital is now at 68% progress, and training of the specialists is ongoing. Constructed new maternity wards and the staff houses in the health center 2s that are being upgraded to health center 3s, distributed 20 digital X-ray machines to general hospitals, and installed CT scans in 14 out of 16 regional referral hospitals. Government implemented interventions for preventive health care, for disease prevention and promotion of healthy lifestyles. For example, trained and deployed community health extension workers across the country to deliver essential health education on hygiene and sanitation, nutrition and disease prevention, and to support routine immunization efforts. Undertook residual spraying in 13 districts, which protected the lives of 2.7 billion people and 560,000 households against malaria, and introduced the malaria vaccine into the extended program on immunization targeting children under 5 years of age. He improved the digitization of healthcare services by extending connectivity of the electronic medical record system in 4 national referral hospitals and 16 regional referral hospitals. This has improved patient record management, drug dispensing, and monitoring the attendance of health workers. strengthened the national ambulance and emergency care system by providing additional ambulances to improve the national emergency response and referral system. Madam Speaker, to further improve the health of Ugandans, a total of shillings 5.87 trillion has been provided in next financial year 25-26. The priority intervention will include 1, functionalizing health centers, 4, 2, strengthening primary health care and community health services, 3, scale up of national e-health infrastructure, 4, promotion of nutrition and education and reproductive health, 5, continued deployment of community health extension workers, 6, strengthening the national ambulance and emergency referral system, and 7, construction of specialized health facilities for cancer and cardiovascular care. Now, education. Madam Speaker, the following milestones have been achieved in the education sector. 1, provided access to universal primary education for 9.2 million learners and 905,116 learners under universal secondary education.
Minister, for record, it is 9.52.
Oh, 452. Well, my officers have misled me. And I close that one. 2, over 5,192 students, both on degree and diploma programs, benefited from higher education students loan financing scheme. In addition, 4,000 learners benefited from government sponsorship joining public universities. 3, a total of 166 seed schools have been constructed under the UGIFIT program. 4, in preparation for CHAN and ACFON 27, government has so far spent shillings 496.8 billion for the construction of Hoima and Akibua Stadia, as well as the associated training facilities across the country. Government will spend a total of shillings 1.3 trillion to get these facilities completed. In addition, Mandela National Stadium has been upgraded, and government commissioned the National High Altitude Training Center, Teriyet, in Kapchorwa. In order to improve compliance with quality standards, government digitalized school inspections in all public schools and certificate awarding technical, vocational, education and training institutions. To improve the qualifications and skills of primary school teachers to meet the new minimum education requirement of degree level, government has established the Uganda National Institute for Teacher Education, UNITE. So far, UNITE has enrolled 1,000 students across 5 campuses and has been supported to undertake staff recruitment and take over the operations of 23 primary teachers' colleges to upgrade certificate teachers to diploma level. Rolled out the abridged A-level curriculum to implement the competence-based curriculum for A-level. A total of 357 120 learners successfully completed the 4-year cycle under the new lower secondary educational curriculum and are transitioning to the new A-level curriculum. Implemented the TVET reform to increase industry participation in TVET training and delivery. A new TVET Council, Sector Skills Council, and the Secretariat have been established with representation from various sectors. Madam Speaker, next financial year, I have provided 5.04 trillion for priority interventions, which include: 1, continuing to provide free education to Ugandans under UPE, USE, and universal post-O-level education and training. 2, providing sponsorship and student loans for higher education. 3, rehabilitation of 120 traditional secondary schools and 31 special need primary schools. 4, construction of 106 new seed schools and expansion of 61 existing secondary schools. 5, recruitment of more teachers and non-teaching staff. 6, strict enforcement of teachers and learners inspection across the country using an electronic system. 7, providing textbooks and instructional materials to improve the textbook to student ratio to 1.3 from the current 1 to 1.5. Operationalization of Bunyoro and Busoga universities, and completion of the ongoing construction of stadia and training facilities ahead of CHAN and AFCON 27, as I've said before.